My name's Tony Menton, I'm from the PHN, and we're here with Kelvin Kong and we're going to talk to him about COVID-19 in Aboriginal communities. Thanks for being here, Kelvin. There's a couple of really important questions that I wanted to ask you, but I'm going to start off with this first one. And is, how do our mob keep themselves healthy during the COVID-19 situation?
Patients and our community and our family still have health issues. One of the frightening things or the adverse effects of the COVID-19 is that we're doing wonderful in isolation, but it means that people are getting too scared to actually look after their health. And that means making sure that your chronic illnesses are looked after, your diabetes, high blood pressure, ailments, all kind of small things, which still need to be addressed. Because if we don't address those issues, then they're going to get worse, and when they get worse, it might be actually harder to fix those things. Now, the beautiful thing about what's happening with the COVID-19 is the different ways in which we're communicating with patients. Now, that goes from a phone call through to a telephone, FaceTime, through to internet conversation, through to telemedicine, right through to seeing someone face to face and actually seeing that. And all of those options are still being used. And depending on how severe they are, the medical professionals or the clinics can actually work out whether or not they need to see you in person or see you on the telephone or just catch up in generally. But the important thing is, don't leave it behind. Even if you're a little bit afraid or a little bit ashamed coming forward, it doesn't make any problem at all. It doesn't hurt anyone just by picking up the phone and saying, look, this is going on, can I speak to someone about it? And mostly those things are solved, and most of the problems I've certainly dealt with have been solved over the phone or over telehealth consult, which means that everything needs to be relaxed and then people get on with things and make sure things are actually going forward. Yeah. Particularly our elderly and our elders need to be very vigilant and aware of making sure they look after their health and get on the phone to someone. If you can't get on the phone to someone, get one of your family members to call on your behalf to make sure it's all sorted out.
So Kevin, the other question I want to ask you is in terms of, health professionals are having to actually adapt and use different forms of communicating with their clients. How are clinicians actually adapting to telehealth?
Yeah, really, really important question, and that's one of the things that I think as health professionals you need to be very wary of in any of those kind of circumstances. You need to make sure that before the consultation, the communication barriers already broke down. So there needs to be something in writing, whether that's by a email or a letter to say we're going to have a telemedicine consult, and explain exactly what that means. It means either we're going to use a telephone or we're going to use a computer to actually do it, and then they might need to download things depending on what software you're using. But importantly, it means that you need to communicate with them and know that they've got a hearing loss with them. When you're actually on the telemedicine consult, you need to do a few things that I always make sure we do. You need to have really good lighting in front of you. When you have good lighting in front of you, they can see your face, and importantly, a lot of our hearing impaired people can't hear very well, so they need to lip read. So you need to shine your face, and it can be quite awkward when you're talking because it's weird from that perspective. The other thing I try and do is look into the camera when I'm talking. You get on those Zoom meetings and you laugh at everyone because they're looking down at the computer screen trying to look at you on the computer screen when in fact you're up here. And if you're looking up there, it means that you actually get that engagement. Although you're not seeing them in person, they can actually read your face associated with that. And they don't want to be looking at your nose hairs, and they don't want to be looking at your bald head going. So you want to make sure that you're actually doing it in a manner which they can see that. And then finally, it's always helpful to utilise some boards. If you've got no, most of the programs we're using have access to a whiteboard which you can draw on so they can see. But if you don't, get a bit of paper and draw it in front of them so they can see that. And finally, when you finish the consultation, make sure the letter goes to the local doctor and they get a copy of that letter. And in that, always put in instructions on what you talked about, and always give them the opportunity to highlight, have a think about it, chat about it, and then follow up with that if they need to at all, either with their GP or with myself or with a healthcare worker, whichever is the best way. So it's the before the consultation, it's actually making sure you do things appropriately during the consultation, and then make sure they understand everything afterwards, because you know how much it can get boring. Everyone's just going, yeah, like you are right now. And afterwards they forget what you're saying, so you need to make sure you follow that up.
If you had any key messages for our mob that are a little bit scared about access and telehealth, what would you say to them?
I was scared. I was scared as a professional using it, and it's quite interesting because when you suddenly see a face on the computer screen, you're like, oh, what's going on there? It looks dreadful. And you really get afraid about using the computer to do that. But now once you've done a couple, you realise that it's just really easy and relaxing, and people know who you are and what you look like anyway, so it doesn't matter. And it's really nice to get that connection with the face, because you might be saying yes, but you're just looking like, what's going on? Or you might be disagreeing and you actually really understand. So facial recognition, particularly with hearing loss, and also when there's cultural barriers, you need to make sure you can read faces and read body language, and that's really important to do that.
Thanks for answering those questions, Kelvin. I really appreciate your time. And for you mob out there, it's really important that you continue to look after your health during this time. There are options like telehealth, and telehealth can mean picking up the phone, having a conversation with your doctor, or doing it via different ways of FaceTime or whatever the practice suggests. Always really, really important to ask a lot of questions to your GP. What is telehealth? What options do I have? Can I do it via phone? Can I do it other ways? Can I actually have a person with me to make sure that I'm receiving the information properly? I've done it. It's pretty easy, it's pretty cool, it's pretty simple. So a good way to stay connected and make sure that you have the latest information is check out if your local GP has a Facebook page, make sure you check that out. Or if your local AMS has a Facebook page, make sure you check the information that is on there and see what's happening in your community. Always remember, you can go in and see your GP if you need to, but just pick up the phone and talk to them first before you do that. Keep safe and look after each other.